everyone, welcome to my channel. I'm Josie, and as you can tell, this is my second channel, Josie Cares. First of all, from the title, Medical Common Sense, I want to put out a disclaimer. I am not telling you not to see your doctor. I'm not telling you to, go it on your own medically. We all need doctors, no matter what. There's good ones and there's not so good ones. I've really thought seriously about doing this subject. I kind of drug my feet about it because I knew there would be some dislike, and I'm sorry if you don't like my content, don't watch this. I am going to base a lot of this on my own life, although I have done some research. I've also done research even more so on my thalassemia that I was born with. But first of all, I'm going to read a little bit of what I found. And why I titled it Medical Common Sense, it doesn't hurt to get a second or third opinion. And I know a lot of times with the insurance companies, this seems to be impossible. But doctors are human. They do make mistakes. They've made mistakes on me. So I'm not just making up this stuff, and I will tell you about it. I looked up percentages of errors made, and it would just blow your mind. So don't stop going to your doctor. Don't stop listening, but do some research. Nowadays, information is so available. Yes, you have to be careful about what you read. Go into the medical sites, not so much blogs from, personal, especially if you don't know those people. I mean, you're just reading something. And again, like I'm going to give you my personal history with doctors. So you can dissect it, you can take it or leave it. I can tell you, I can prove everything I say. But anyway, like I said, just use some common sense. If doctors suggest a medication, go home and maybe look up some of the side effects. Yes, all medications have side effects. You have to weigh the difference. Is this medication going to keep me alive? Or is it just going to maybe cover up symptoms? But the side effects are worse than the symptoms. So just use some common sense. And it doesn't hurt to ask different doctors. Request a referral. Request seeing a specialist. All of it may save your life. And before I start on my particular life, misdiagnosed and delayed diagnosis. A delayed diagnosis of cancer or a serious condition can mean the difference between life and death. I have a family member who has passed on, about 3 or 4 years ago. And she had cancer, had battled cancer for many years, started having symptoms, went to her doctor, and I kept telling her, go see another doctor. Well, by the time that the other symptoms came on, the cancer was in her bone and it was too late. So just, like I said, doctors are not God. I'm sorry, but they're not. We need doctors. Hey, each of us needs a doctor. But again, common sense. So they do misdiagnose. Surgical mistakes. Analyzing data from 1990 to 2010, the journal Surgery estimated roughly 4,000 preventable surgery injuries each year. That's a lot of mistakes. I have to say, when I had my hernia surgery, and this is kind of a common thing, so I like the surgeon, I'm not condemning him, but he nicked my bladder. I had to stay in an extra day, and it could have been more serious than it was. So mistakes are made. Like I said, they're not God, they're human. Prescription drug errors. The Patient Safety Network estimated that 700,000 emergency room visits with 100,000 hospitalization each year are the results of adverse drug events. That's a lot of mistakes. Know your allergy list. If you've ever had problems with a medication, inform your doctor. Make sure it's on your allergy list. You know, they need to know. Like, I'm allergic to iodine, and I cannot have a lot of the test. So that's one of the first things I always remind them, and it is on my medical records. So anyway, I'm going to start with, and please, if you have any questions, and I don't mind, as I say in all my videos, I don't mind constructive criticism. Rudeness, I just delete and block you. It's a waste of time. I'm not going to do a debate. I do research when I do the videos on this channel, and I also, and the reason why I bring my own personal life, my theory on this channel is if I can help one person, that's all I ask. If, you know, I know everyone's not going to be interested in listening to some of the subjects I talk about. Okay, I was born with thalassemia. Both my parents were Italian, and in the Mediterranean countries, thalassemia is pretty prevalent. It's maybe a lighter version of sickle cell anemia, but also I have thalassemia minor because one of my parents had it. If both my parents had it, I would not be sitting here talking to you. So it's really important for Italian families or Italian people when they go to get married to be tested and see if one of them has a thalassemia. If both have, they should not have children. Or maybe not get married. I don't know. I shouldn't have thrown that in there. But the history of thalassemia, it was discovered in 1925. In 1943, there was, more discovery. So, 1925, that's way beyond my time. I'm old, but not quite that old. 1943, I was 3 years old. I was born with this. And I remember as a child, apparently, for some reason maybe when I had my tonsils out, I don't know. But my parents found out I had anemia. Okay, anemia is curable, and I will read some of this. Thalassemia is not. Thalassemia patients should never have iron of any kind, or aspirin. I didn't get diagnosed until I was 45 years old by a neurologist. My lab work is never normal. In fact, when I go and have a blood drawn, I always say something to the lab tech because, they see something really unusual. They are always alerted. And I said, my labs are never going to be normal. I was treated with iron, even iron shots, which could have killed me. Because with thalassemia, your body builds up this iron overload, and it's very dangerous. Even when I worked in the hospital, the doctors never, and the lab tech, which he couldn't give out all the information, kind of hinted to me that my labs were off. And that's where I made the mistake. And that's why I'm doing this and alerting you. Question. I guess I just let it go because, I worked at the hospital. I thought, doctors, care about their patients. If there was anything serious, they would let me know. Wrong, especially now. And the only way I got diagnosed with thalassemia, I was having problems with my left leg, which I have now, but I had actually gotten hurt bowling, by the way. And they couldn't figure out what was wrong with me. So they sent me to a neurologist, which he was great, I have to say. Fantastic doctor. And this was in Oregon. And they did all sorts of tests, bone test, bone scan, everything you can think of. And when I went in to see him, he said, by the way, do you know you have thalassemia? And I must have had this shocked look on my face. And I said, what? Because I didn't even learn about thalassemia in nursing school. And by the way, very few doctors know much about it. I found out the surgeon that did my hernia told me all about it. And it was refreshing. He was the first doctor that actually addressed thalassemia. And he said, you should never have aspirin or blood thinners. So I dealt with that. And that was one of the reasons that when I was a child, we lived on a ranch, and we picked prunes off the ground. You shake the trees, the prunes go on the ground, and I would get very dizzy. And my parents didn't understand it. I'm sure my father thought I was just being lazy. That was a sign of thalassemia, plus Chiari that I was born with. And doctors, and every doctor that I have went to, even now, never addressed that some of my symptoms are related to those two diagnoses. It's like, they don't want to address the real cause. I had my primary doctor tell me just recently, well, I don't know what's wrong with you. I have lymphedema. Went to physical therapy. They absolutely don't know anything. So I've been doing some research, and I'm actually was referred to another doctor to find out why my lymphedema is kind of, swelling a lot, even more. And this one doctor told me, you shouldn't have to be dealing with that. There should be something done. And I admire, once in a while you come across a doctor who really addressed the problem. So many of them just, want to give you that pill and scoot you out of the office. Well, I don't. I take very little. I do not believe in a lot of pills, and I'm a retired nurse. The side effects sometimes are worse than the symptoms. Anyway, I will tell you a little bit about what thalassemia. And a lot of people have anemia. That is like anemia is caused by many factors, but thalassemia is caused by the mutation of genes. Anemia can be treated by proper diet and medicine, but anemia caused by thalassemia has to be treated by blood transfusions. And that's for children too, and who have thalassemia major. It's usually they don't live to be too old. Anemia is caused by conditions, but thalassemia is caused by inheriting it from parents. So if both your parents have it, your lifespan is very short, and you have a lot of blood transfusions. Anemia is preventable by proper diet and medication, but thalassemia is prevented only when parents know that they are carrying the mutated genes and get tested for the fetus when it's 10 weeks old. And the thing is, you should be tested before you ever get pregnant. And I say this, and I didn't mean to bring that into this video, but I am anti-abortion. So, anemia is cured in a very short period of time, but thalassemia is not curable, and one suffering from it has undergone blood transfusions throughout their life. I have been very blessed and fortunate. I only had one blood transfusion, and that's when I gave birth to my daughter many, many years ago. So, even today, I have not had one doctor other than the surgeon talk about my thalassemia, my Chiari. They absolutely have no idea. And so I do a lot of research. And I want to point out that if the doctor tells you something, not that he or she is wrong, but they do make mistakes. And it's your body. It's up to you to maybe request a referral, see another doctor. The reason why I decided to even do this, I've heard people say, well, my doctor said that this was fine, I should take this, or I should do that. No, you know your own body. Not saying he's wrong, but if I took everything that a doctor would tell me years ago about pain, I do not take. I take a thyroid medication and a GERD medication for the esophagus, and that's all I take. And I'm 81 years old. So, you know, I believe in vitamins. Overweight causes problems, and right now, since should I say, the pandemic, there's a lot of obesity, and it's nobody's fault. It's just, when you're in the house a lot and you're watching TV, or you're gonna snack, and it was hard. There's a lot of people. Hopefully people are getting out and walking now and watching their diet, and although with the price of everything, it's really hard to eat healthy also. So if you have any questions, please ask in the comment section. I decided to do this because I actually been misdiagnosed most of my life. And you might not believe this, and I'm not trying to push my religious beliefs on you, but I will say this, and if you don't like my channel, that's fine. I had severe pain in my left leg they say due to lymphedema, and I even hurt when I turned over in bed. It was that bad, but I lived with it every day. And I just gave it to the Lord. I prayed that, you know, whatever's going to be is going to be, but give me the strength. And for the last 2 months, I haven't had pain in my left leg. And the doctor couldn't even explain that, because I told him about it. And he said, well, maybe your body healed itself. That was his answer. And so, like I said, go to your doctor, but ask questions. If he wants you to take a certain medication, make sure you remind him what you're already on, because sometimes, doctors are busy. They have a lot to deal with, especially pressure from insurance companies. I had a doctor that I really liked, and because he didn't want to deal with insurance companies, he went cash, and I couldn't afford to go back to him. And I understand that. So they have a busy schedule. So if you know what medications you're on, or at least you should, and he or she orders you something new, just remind that doctor, is this compatible, you know? And most of the pharmacies are really good about that. If they get a doctor's order for you and they see there's medications that do not mix, they will let you know. At least I've seen that in the past. So anyway, hope you get something out of this. Like I said, I'm sure I'm going to step on someone's toes and they're just going to think I'm full of it, and that's okay. That's why I separate this from my other channel. I call it my serious channel, and I express myself just the way I feel I should. And one thing I can guarantee you, it comes from my heart. I try to be honest with you. And again, the disclaimer, please go see your doctor if you have a problem. Just remember the common sense. Ask questions. Ask why, what for, ask your prognosis. Is there anything you can do besides, you know, a pill, exercise, diet, fluids? Sometimes, you know, we're even allergic to a certain food product, and it causes people who cannot have dairy have some severe side effects. There's people who are allergic to gluten. So, you know, look into what's going on with you. Anyway, I have talked much too long, so hope to see you later. Bye, everyone.